Welcome to a new episode of the Health Basket. I am Dr. Ramasubramanian. I am the Medical Director of Capstone Multi-Speciality Clinic in Nungambakam, and I am a consultant infectious diseases at Apollo Hospitals, Chennai. If you have to travel, ensure that you keep your hands clean and stay away from crowds. Whenever people come into close proximity, the chances of infection being transmitted is high. So you ensure that you do not stay in crowded places. Keep your hands clean. As I told you, the infection is more likely to be transmitted by touching a surface which is contaminated by the virus and taking the hands near the mouth. So by keeping our hands clean, either by frequent washing or even better using a hand sanitizer, an alcohol gel or an alcohol sanitizer, keeping it and using it frequently probably will help you stay protected. If there are people who show infections in the form of cough and sneezing, there are 2 or 3 things they need to keep in mind. One, there is something called the cough etiquette, which means when you cough or sneeze, sneeze into your elbow so that you don't splatter the droplets around. If you're using a tissue, make sure that you cover your mouth and nose with a tissue when you cough or sneeze and dispose of the tissue immediately. I wouldn't recommend using handkerchiefs because handkerchiefs we keep reusing. So after we use it, it goes to our pocket, it contaminates our trousers, it contaminates our hands, it contaminates our immediate environment. So this is not advisable. Tissues are probably what we should need to keep on hand when we are having any illness. Again, when you're having a cough or sneezing on a regular basis, please use a mask. A person who's infected using a mask will prevent the infection being transferred. Is there a role for masks for all other people? No. Even the WHO says that routine use of masks is not indicated unless it is a healthcare worker who's taking care of patients who are infected. We become very complacent when we wear a mask and we think that we are protected, but even handling the mask frequently can increase our risk for infection. Masks should be worn only when probably in a situation where you come into close proximity with patients or people, like when you're traveling by air or by train, where you are very close to people and you cannot help it. In that situation, trying to protect yourself with a mask may be advised. A triple layered surgical mask is what is indicated. The N95, I would still say the healthcare workers need to use it, but routinely others using it may not be advisable because they may not use it correctly. Apart from this, I insist, keep your hands as clean as possible. Try to keep your hands away from your face. That is the best way to protect yourself. There is no vaccine yet available for this infection. Studies are going on, but I think it is going to take some more time. So, in summary, the coronavirus is a mutated virus which usually causes infection in the nose, but this mutated virus causes pneumonia, which can lead to death in 2 to 3% of the population who are infected, especially elderly people who have underlying heart-lung disease. The infectivity is slightly more than the flu. The mortality rate, if you compare with the flu, which is about 0.02 to 0.4%, this is higher, about 2 to 3%, but still much lower than SARS or MERS. MERS has a mortality rate of 30 to 35%. So this is not as severe as the earlier infections, but it is slightly worse than the flu. It is likely to spread fast all over the world because of travel, and the way it travels, it is transmitted by droplet method. But taking adequate precautions in the form of cough etiquette, ensuring clean hands with sanitizer, staying away from crowds and traveling less would definitely help all of us handle this better. Let us face this for the next few months, but let us stay safe. Thank you.
Health tips for healthy life. For more such health tips from the senior doctors, subscribe to Health Basket channel and click the bell icon to get notified. Stay connected to us through our social platform.